In this lesson, we'll go over some of the most common mistakes that cause test takers to lose points on the HHA exam, both in the written and skills portions. Avoiding these simple but critical errors can make the difference between passing and needing to retake the test. From misreading questions to forgetting key steps during hands-on demonstrations, we'll walk through what to watch out for and how to stay calm and focused on test day. Let's start with one of the biggest mistakes candidates make on the written exam: misreading the question. A major reason test takers miss questions is that they rush through reading and misunderstand what is being asked. Many questions are scenario-based, so it's important to read carefully and focus on keywords like first, best, most important, or next step. Strategy: underline or mentally highlight key parts of the question and eliminate clearly wrong answers before choosing. Another common mistake is choosing based on personal experience. Some test takers answer based on what they did during clinicals or home training, which may not always match standard procedure. The exam is based on textbook safety and guidelines, not personal shortcuts. Strategy: always choose the most correct, safest, and most respectful answer, even if it's different from how you saw it done. Guessing without eliminating answers. Random guessing can lower your chances of selecting the right option. Strategy: eliminate obviously wrong choices first, then make an educated guess. This increases your chance of picking the right answer from 25% to 50% or more. Not managing time. The written test usually allows plenty of time, but rushing or overthinking can cause mistakes. Strategy: pace yourself and flag difficult questions to come back to later. Now let's review the most common mistakes that can happen during the skills portion of the HHA exam and how to avoid them. Skipping hand washing or infection control. Hand washing is one of the most failed steps, and it's often the first skill tested. Forgetting to wash hands at the right times or not washing long enough can result in automatic failure. Strategy: always wash your hands before and after patient contact and use proper technique: 20 seconds, friction, rinse, dry, turn off faucet with paper towel. Performing skills out of order. Most caregiving tasks must be done in a specific sequence to ensure safety and efficiency. Performing a skill out of order, like feeding before checking food temperature, may be considered unsafe. Strategy: practice each skill in step-by-step order, using a checklist until it's automatic. Not providing privacy or respect. Forgetting to knock, introduce yourself, or pull the privacy curtain may lose you important points. Strategy: always follow professional protocol. Treat the client or mannequin with the same respect as a real patient. Not communicating with the client. Silence during a skill may be marked as lack of care or poor patient interaction. Strategy: always explain what you are doing, even if you're nervous or it's a mannequin. This shows confidence and professionalism. Forgetting safety measures. Leaving the bed too high, forgetting to lock wheelchair brakes, or failing to lower bed rails after care are common mistakes. These are considered critical errors and may result in failure. Strategy: always finish each skill with safety checks. Call light and reach. Bed low and locked. Hands clean. Let's talk about common behavior-related mistakes on exam day and how to avoid them. Arriving late or unprepared. Being late or forgetting documents, like ID or exam confirmation, can prevent you from testing. Strategy: prepare everything the night before, arrive at least 30 minutes early, and dress in comfortable, clean clothing, scrubs if allowed. Showing anxiety or lack of confidence. Nervousness is normal, but freezing up, mumbling, or forgetting steps due to panic can hurt your performance. Strategy: practice until confident, breathe deeply during the exam, and move slowly and deliberately, not fast and frantic. Confidence doesn't mean being perfect. It means staying steady and focused, even when you're nervous. Not asking for clarification when allowed. On some written exams or skill stations, you may be allowed to ask questions if you're unsure of instructions. Strategy: don't be afraid to ask. If allowed, it's better to be clear than to guess and fail. To succeed on the HHA exam, Awareness is key. Avoidable mistakes cause many HHA exam failures. Written test. Misreading, bad habits, poor time use. Skills test. Missed hand washing, safety, or communication steps. Other issues. Being late, nervous, or unprepared. Tip. Practice with checklists, simulate the test, stay calm and professional. You're now one step closer to certification. Let's move on to the next lesson.